All right, good morning, everyone. My name is Deanna West-Torrance, and I want to welcome you all to our session as part of the Ohio CDC Association Annual Conference. This session is entitled Community Engagement During COVID-19. I want to run through the agenda just to let you all know how things will go. So I'm going to kind of read through a list of housekeeping items and technology items before we get started. This session is being recorded, so you will be able to access it later. The Dropbox link should be in the chat session, in the chat box, and will give you access to some of the resources from this session. If you'd like to turn off your camera, please feel free to do so. Although when we go into breakout sessions, we would encourage you to turn it on during these interactive moments. We also want you to feel free to toggle between your speaker view or grid view, and that's in the top right hand of your screen. The speaker view will highlight the speaker, and the grid view will show you all the boxes. I'm sure by now most of you already know this. Closed captioning can also be accessed by clicking the Otter AI on the top of left side of your screen, and that's going to open it into another window. We have muted everyone to eliminate background noise, and the chat is being monitored by questions. Please send your questions in the chat to questions, and to chat privately with a specific person, you can just select their name from the drop-down menu. Finally, please be sure to visit the exhibitor space to check out some of the conference's sponsors. Those links will also be in the chat, and we want to thank all of our sponsors for supporting this awesome conference. All right. As I said, my name is Deanna West-Torrance, and I'm the Executive Director of the North End Community Improvement Collaborative in Mansfield, or in Richland County, Ohio. I want to thank all of you for joining us, and for joining me for this session this morning. All right. Want to make sure that I've given you all of the other information that you need. We may be having breaks, so we will have someone that will be monitoring your questions again during the session in the event that there are things, and they can feel free to interrupt me if there are specific questions needing to be answered during the session. If not, we'll have questions at the end. All right. So as I said, I am from Mansfield, Ohio. Oops, and I've gone too far. There we go. To tell you a little bit about Mansfield, we're about close to 47,000 people. Our county population in Richland County is just over 121,000. And it's a mainly rural county with just an urban center, which is Mansfield. And that presents our community with some really unique opportunities and challenges when you're an urban center in the middle of a largely agricultural community. At NECIC, we serve 3 census tracts on the north end of Mansfield. We serve 6, 7, and 16. And I've broken out on this screen for you the numbers, the population. So in total, we're serving about 2,000 individuals in our service area. Our mission is to improve the quality of life and the economic landscape of the North End community. I was born in the North End, raised my children largely in the North End, and have moved away and come back, and over the years just seen several things that have happened that kind of showed a decline in the neighborhoods. We became a food desert, our grocery stores closed, and so it was an area that was largely industrial. We had way more industry than most people for the size of the community we had. And so over the last 40 years, we've seen things kind of close. And so this particular neighborhood was largely impacted. It was very working class at one point, but as those jobs have gone away, just like many of our cities, it kind of fell into disrepair, lots of disinvestment. And so as an organization, our vision statement was that while in the year 2008, which is when we started late 2007, but in the year 2008, we were considered a drain on the local economy. But in the year 2028, we're the leading engine of economic vitality, positive youth development, arts, and civic engagement. So that's the vision that we've continued to work for and worked towards rather since we opened our doors. Our programs, just to give you a little bit of background about the organization, we operate a social enterprise. We have a staffing service. We staff for local companies here. And also we do affiliate staffing for other staffing companies. Our goal when we opened our staffing company was to provide support, community health worker support, and that kind of additional support as people were working through their temporary assignments with the goal of them being hired in full time. We also operate an open table mentoring program in which we convene folks around the community. They go through a group training, and 6 to 10 of those support young people by meeting with them once a week, generally for a meal. That has drastically been impacted by COVID, as we haven't been able to get people together, but they have been conducting their business through Zoom as well and meeting with their mentee through Zoom. We have the African American Leadership Initiative, which has been really busy, and I'm going to go back to that a little bit later and talk about some of the work that's falling under that umbrella. We also have the Micro Business Development Program supported through the Ohio CDC. We appreciate that. And also we are a Minority Business Assistance Center office in partnership with the Akron Urban League. We have an elder program where we have seniors in our community. We had no senior center, so they come together twice a month. And then lastly, we have the North End Local Food Initiative, and I will get into that a bit. We call it NELFI for short, and NELFI really started with community gardens and us supporting community gardens. We received some block grant money from the city, and we support up to 29 gardens at one point throughout our county. We have a teaching garden in which there were 3 really blighted structures that we turned into a demonstration garden to teach folks in the neighborhood how to grow food. And there we launched our farmers market, which is the next bullet item you see. The farmers market was really about helping our residents take that to the next level, maybe start growing to see, you know, is this something we can make money to do? Can we make money doing this? And again, this happened after we lost our last grocery store in the neighborhood. Lastly, though, we were very, very fortunate to partner with Ohio State as an organization. We had been doing a lot of strategic planning. We'd had 3 years of VISTA support for our food work and decided that we really wanted to step it up. And so we started this Mansfield Microfarm project with Ohio State, in which we are now supporting in this community several food-based entrepreneurs who are micro farmers. They are growing food, they have organized into a cooperative, and they are selling to hospitals and local restaurants. We partnered with Gorman Rupp, which is a large company here, who had a lot of space right in the middle of our neighborhood. They had torn down their former facility. It was in disrepair, just kind of overgrown, and ended up having a great fence around it. And so we were able, through the help of our local foundation, to take that space and have our micro farms. So we host 2 North End farmers on our site as well. And that's been, and then we kind of wrap around small business development and all of that with those micro farmers. So to talk a little bit about how we were impacted, I want to talk just briefly about how we were impacted as a program and as an organization, and then community-wide. Our community organizing work, which were our small grants program, our elder program, some of our ally work, the African American Leadership Initiative, and our staffing service were all impacted. As companies closed and shut their doors, certainly the temps were the very first people to go, so we saw that happen. Our elder program, we lost 2 elders within the first 30 days. 2 passed away due to COVID, so we were definitely impacted in that way. And so Nyasha Odin, who is the community organizer that runs that program, has just been, since we've had, you know, we haven't met since March, has just continued to reach out, call those elders just on a rotating basis. And we've been able to kind of just check in with those folks. We don't have a senior center here, so the elder program has really served since 2007 as a place where we work with and we can kind of touch bases with our neighborhood elders. But also, as most of you know, during this time, there was racial unrest that rose, and Mansfield was definitely no different. We were Mansfield is a very racially polarized community, but there had started to be some efforts related to the health disparity issue and racism being declared a public health issue. When we saw that happen in Franklin County, that was something that we really, really felt in our community we wanted to take on. And so we decided that we had these two challenges that we wanted to address in our community. And the questions we looked at were, how do we move forward in this currently racially polarized environment or highly polarized environment? And then how can we leverage our assets and our position in the community to address those two things? We are an organization that is very, very, very involved with a lot of the systems here. And so we have built really good relationships in a whole lot of areas, whether it's with the business community, with the social service community, with our schools, with our college and university here. We have really, really good working relationships with all of them. And so we looked at how do we kind of spend that, those relationships and that capital to benefit the folks in our community. So one of the things that we did as a program and as an organization was we moved a lot of our content to digital platforms. And we, like everyone else, moved a lot to Zoom. As I said, with our open tables, the mentoring, they were able to move that. The micro business classes were able to be conducted via Zoom. So we did move a lot of things over to that platform. We also really, really increased our social media presence. We have Shayla Bradley, who is our communications and community engagement coordinator. She really has done a lot. We've tried to put out a lot of information that we're getting as it related to COVID with our folks and so forth. As I mentioned, we kept in contact with our elder community by daily phone calling. And then because we did have the staffing service, we benefited greatly from the PPP loan funds that allowed us to hire some staff to come work on our farm actually during that time. So we were actually able to bring some temps onto our farm and help us with our work during the slowdown and provide some income to some of our folks here in the community and in our neighborhood. We held a lot more events outside at the farm. We moved our farmers market, kind of became a central place. So we were able to have the census worker there. We had a census outreach. We've had the dental clinic from the health department there. Several organizations, our children's museum gave us 175 activity bags for kids and parents to do over the summer. And so we were able to really use our farmers market instead of our office as a place for us to share things with the community. So that farm really did emerge as a solution. This was our first year with the farm up and running. We have 8 hoop houses, large hoop houses there. And it's, as I said, it's 10 acres. So we were able to socially distance. We saw huge increases in our market where before, when it was in our teaching garden, we might have had 25, 30 people. For most of the season, we exceeded 100, even up to 140 people at the market, which was really good. And we saw a lot of foot traffic. So we realized we were really serving the neighborhood in a lot better way than we had in the past. And our residents were really anxious to get outside. So the second issue that we faced was the racism issue. And so we worked with our 6th Ward Councilwoman, Jean Taddy, who was also our first community organizer here at NECIC years back. And so she proposed a resolution for City Council to recognize racism as a public health emergency, which ended up being a very, 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 very hot topic here for a number of weeks. They even postponed voting on the legislation, which eventually did go down. It lost, and it was just one of the most surprising things because we really did not expect to lose that. What happened was a lot of the faith community actually came out against that proposal, and there was some on the ground political organizing really that we had never seen in this community. So that was another setback. However, there were 9 women, I'm one of those 9, who brought together our organizations and decided that we wanted to launch a task force to look at systemic racism in Richland County. And this is a big deal in a community like this, where most of our folks are rural people who are running. All of our county commissioners are rural and everything. And so to really put a focus on this issue here was a big deal. We looked at the task force recently launched. We have a steering committee, and we are looking at identifying racism within, I'm sorry, systemic racial practices rather in business, criminal justice, education, employment, health, mental health, and housing areas. We formed a steering committee with 2 chairs. Each chair has a work group with 2 people. The work groups will launch in January, and they'll be comprised of subject matter experts. So we are looking for expertise in each of those areas, and publicly paid employees within that sector. So housing, for example, you want your fair housing officer to be a part of that. And also concerned individuals and organizations. We've been really, really deliberate about trying to limit the number of the political influence on this in a big way, and have formed a group called Champions for elected officials who want to support this work. But we really don't want to be part of anyone's agenda, and we feel like there's real work to be done. And that work was largely based around a report that our research and development coordinator, Edward Akinyemi, wrote called the State of the African American in Richland County Report. We gave that to our foundation as part of the Ally Project. It was our final report, and it provided this community with some data that they'd never looked at before. And it's stark. And so there was no way really that people could ignore what they were seeing. And so we had right out the bat some very influential folks in the community move to the forefront and said, I want to help champion this. And they were unlikely people, like the president of our chamber, who's also on my board, who really, really wants to engage the business community in more equitable hiring practices and improve the chamber itself here among their own staff and board and that kind of thing. Also, the president of Ohio Health, immediately, he was the first person to step forward. And so not only were we able to get people like that who can kind of insulate this process, but also people just who have worked in the fields, people who have like worked in these respective sectors. And so we put together a really good group. We also have a professor who focuses a lot on race, and he is our evaluator. The project is 5 years long, and that was deliberate because we know it is about building relationships. And so we feel like if you're within the housing sector and you're working with other housing professionals and you are looking at, they know where the bodies are buried. They know where those systemic issues are that advantage one group over another. So, and many of them have started right out the bat doing that. So through the end of the year, the steering committee is meeting for 3 hours. We meet this Saturday from 9 to 12. We're doing that through the end of the year with the work groups launching in January. And so our goal is that you'll have a group of colleagues, supporters, all learning the same thing as we go. We have a community education expert, someone who another professor, this is their field, who's really, really working with educating us as a steering committee. And a lot of resources that people in larger cities often have that we just don't have that capacity here. So we've really been deliberate in trying to figure out what is it that we're missing here and how can we knit some of those things together. We also have on our steering committee a public relations and two media experts so that we can tell the story as we go, because we're looking at this from day one, evaluating how we're doing as a community and making sure that the public is knowing what's going on as we're doing this, and what kind of public education platforms can we have, and how can we make sure that we're using common language, that we're beginning as a community to grow together within that. So we also have signed a governance document in which the steering committee is agreeing to certain things, that we're going to support this, and we're going to look at our own organizations in terms of how equitable we are behaving and how we are comprising our boards and how we are. So there's a commitment from organizations as well. And so next, we feel, like I said, that we'll have new relationships that are built, better outcomes, a healthier community, a more adaptable and effective organization, and a more just economy and community. It's interesting in closing, as I think about this, some of you may know that there was recently an issue here with our police and a young man, right? It was in the North End, actually. And so right now we are seeing a flare up again. There's a protest planned for Saturday. And so we also engaged in writing a code of conduct for police and community relations with a group of other folks in the community. So I think organizationally, people are trying to align, but I think that there's work to do in terms of the community in general, embracing this work and understanding the value of it. I think that that's a challenge that we have. But right now, the systems that need to line up are beginning to do that. And so we are, so even though during this pandemic, it's been definitely a challenging time for all of us, I feel like here in Richland County, we've been able to take advantage of this time and get some good work done. So I want to thank you all. I haven't looked at my time, but I'd like to thank you all. And I believe we will move to some questions. First of all, if there are any questions for me, I'm going to stop sharing my screen here. And do we have anything in the chat box? Alana, do we have anything? Or
it does not look like we have any questions.
Jarnay, okay.
Okay, there you go.
Do we? Okay.
Yes. So Philip would like to know, being almost 2 months into having a farmer's market at our learning garden, Franklinton Farms in Columbus, what do you feel was the most successful method of engaging your community to come out to the market?
Interesting question. When we first started, we started our market long before there was a farm and even before there was a teaching garden. We did that work as part of our community gardens. And so our first market we held at our elder program. And we thought that was the best idea ever because we didn't have a grocery store and we'll have the fresh food right here. And they would walk right past. Our program was largely African-American, probably 90%. And so we have an elder that sits on our board. And so I called her and I'm like, I don't understand what's going on. And she started talking to me about the dynamics of who's here and where the Black community in our neighborhood come from. And that we like going to the store. We moved here to get away from growing food. And so that just really was like kind of an eye opener for us. And so, so we moved the market to different places. We talked to our elders. We continued to really educate more about, food justice and food deserts and what was really happening to the community at large. We did a lot on public information. I feel like we've talked about it for forever. And so I think the most successful thing in engaging though was to talk to them, find out what foods they wanted us to have at the market, find out, we even had cooking demonstrations. Those did work. That definitely worked. We had someone come from Youngstown and talk about African-American food, the African-American food experience. So we've tried to kind of lean into some of that. I also think that Monica Nice, who's our teaching garden coordinator, does a fabulous job working with after-school programs. So I think having kids get involved, we started a 4-H group actually, which is the first city one here. All of that has really, really helped. So those were all different things. I think talking to the residents and really trying to understand where the constraining steps were and addressing those directly was helpful. So I think we are going to move to our breakout sessions now. We'll have 3 to a group, I believe. I don't know if Alana, if we're still doing 3 to a group. And as we go into the breakout session, we will do an icebreaker. And this will be, there are questions in the Dropbox chat as well. Are we doing the consultant exercise?
Yeah, we're gonna move on to the consultant exercise. I can explain it if you want.
Okay. Go ahead.
So what we're doing is we're doing 3 people to a breakout room. And it's basically, so think of a situation or something that you're having problems with, and what we're going to do is, so there's 3 people, person A, B, and C. Person A is going to explain their problem for exactly 1 minute. And then person B and C will have 2 minutes to ask clarifying questions. And then person B and C will then brainstorm solutions for person A. During this brainstorming session, person A cannot talk and they just sit and listen. And then they have 4 minutes to brainstorm. And then after those 4 minutes, person A will summarize what they heard from person B and C. And then we will switch to another person. So everybody in the group will have a chance to say an issue that they're having, and then hear feedback or possible solutions for that. I know that might sound confusing right now. So we've dropped the instructions in the chat. So feel free to reference that when we divide you into breakout sessions. Some of you might only have 2 people in your breakout room because of our participant number. That's okay. That just means you have a little bit more time to talk, and I will be keeping track of the time. So you should see a message from me being broadcasted to you while you're in your breakout room. So we are going to do that right now.
Okay, thanks everyone. We are coming to a close, and before we finish up, I want to say thank you for joining us for the session today, Community Engagement during COVID-19. We know a lot of people are a little bit Zoom weary, so we really do appreciate you coming in and spending this last hour with us. I also would like to thank the team at Ohio CDC Association and the folks who've helped with this session, Alana, Tuba, Janae, and Lisa. Thank you very much. We hope that you can join us for more of the conference coming up today. The next national session will be the Pandemic, Public Health, and the Opportunity to Strengthen Communities. You can get more information about the rest of the sessions today at resilientcommunitiesforum.org/myschedule/. Friday, we'll all get a survey basically to give feedback for the conference here. And so we really look forward to everyone completing that. I also want to make sure, I don't know that we have time for any more questions, but if there are, feel free to, I want to just check with Tuba and make sure there's not anything lingering. Or I'm sorry, Janae, is there anything?
No, no one submitted any more questions.
All right, well, thanks everyone. And I want to just, again, thank everyone for coming, and we certainly appreciate your all being here. Enjoy the rest of the conference.